Aesthetics, we did have like a little mention before that, you know, you could do a bit of Botox and fillers. A lot of the dentists are
Just
actually
to
moving.
jump in there.
Yeah.
Guys, Botox and fillers. I don't think he's talking about tits, he's talking about lips. Or sorry, I should say breasts to be perfectly
Yeah.
PC. He's talking about breasts. No,
Yeah.
lips.
Lips,
What
yeah.
you see a lot of those, let's say, people of the lighter complexion with.
Yeah.
Yeah.
I mean, so yeah, with Botox and fillers, it's become a very, you know, it's becoming a trend now, to be honest. A lot of people are doing it. It's rewarding for the, you know.
Do you know how to do it already?
Me, from a theoretical side, yes, but for practicality, no. Because
what I find, sorry to jump in there again,
yeah.
a lot of people, the first time I saw anyone's lips, there's this white lady got in the car, I think she's a prostitute or stripper or something like that, and I thought someone had just punched her in the mouth.
No way.
Lips, and her lips was just going, and I felt like saying, "Are you okay? Do you need to talk?" kind of thing. But what I'm saying is, they weren't like normal. Let's say, like, obviously black people, we've got larger lips, so they weren't kind of level.
Of course, there's an imbalance in there.
Yeah, thank you.
Yeah.
Imbalance. Is there anybody who can do it properly that you see?
I mean, look, when it comes to medical things, just generally, there's no such thing as perfect. We can say near perfect, but I would never guarantee to someone to say, yeah, this is like the best of the best. Because if I, for example, say, let's say I'm very good at what I do and I've got 10 plus years of experience and I can do it inside out. But next thing you know, if another person does the same thing, he can say, you know what, I could do better. And then the next person can say, you know what, I could do touching up a few things here and there, and I could do even better than that. So aesthetics is like a much more of an opinion, I feel like. You know, some people say, you know what, bigger lips suit you better. You know what, you need to have a bit more smaller, you need to have a bit more extra contouring, all that kind of stuff. So it's not very easy. That's why it's a very hard business to get into, especially if you don't know what they want. Because some people go like, oh, I just want fillers. Like, what kind? Do you want a really massive fillers? Do you want big fillers, small? And then again, you can give something what the patient wants, but then obviously there's a health risk. And there's a lot of health risks to these aesthetics things. There is complications.
What kind of complications have there been?
Blocked vessels, clotting.
In your mouth, in your lips?
Well, yeah, I mean, you're going through kind of like near the veins. And God forbid, if you ever touch the veins, you know, there can be complications.
So what happens if you touch the veins?
You need to stop what you're doing. So, for example, let's say during the procedure, I mean, not like the whole thing, but like during the procedure, God forbid, you would just pierce the vein or something. You need to stop, take it out, obviously, in a safe. Bleeding. Yeah.
You have to cut the person's lip open.
Oh no. So we have to just like, I mean, obviously because I haven't studied the course itself, I'm not sure exactly what you have to do. But as far as I know, you need to stop it, take it out, and just, I think you got to apply. There is some numbing that you need to do to kind of stop it from bleeding.
But surely you numb it before you put the injection.
Oh, of course, but there's some extra numbing that you need to do just in case after it.
How do you know if you've hit the vein?
So what happens is you need to do something called I think it's called air suction or something. So during the syringe, when you're pushing it in the chemical inside, you need to always slowly like kind of take it back out just to make sure that you haven't hit any veins. So what happens is, if you push it back out, there's nothing there. That's a good sign. If you see blood, then yeah.
I don't see how all that kind of risk is worth.
I mean,
trying to make your lips a bit bigger for beauty purposes.
Bear in mind, I mean, this is gonna get into a whole different kind of topic, you know, about beauty.
We got time.
I mean, we got time, but obviously then people will start to go like, who's this guy? Who's this? What's the name? I want to know him. I can have an opinion.
You could be getting clientele for this. I want a commission.
I'll shout you out as well, don't worry. Like, don't know that cab driver.
No, I wish you well either way. But no, to me, it fascinated me.
Really?
It fascinated me that people go through or put themselves through that. What I am interested in is the liquid that you pump in there. What is it?
It's hyaluronic acid.
What?
Yeah.
Acid?
It was not acid. Hyaluronic acid is like a type of how do you say it? Well, from the theory side, I believe it numbs or paralyzes the nerves. So like, how do you say it? So it fills up the area. So the area that you want it to have. So if you, for example, you want to have more bigger lips, and then it paralyzes the area. So that means it stops it from like kind of moving around. So you won't have like the liquid moving around all over the place, and it'll look all slashy. So it'll just be fat, just thick, and just, you know. It's kind of hard to picture it when I'm like.
Seem right. This seems wrong in every
I mean,
way.
look, it's never good to have any kind of these things. A lot of the cosmetic procedures, obviously, it's cosmetic. But to be honest with you, a fun fact with Botox, there is some actual benefits to it. So, in certain areas.
That's
so,
when they inject in your skin in your cheeks as well, isn't it?
Yes.
Make you look.
So with Botox,
make you look young, hairy.
yeah. So with Botox, literally, if you, let's say you got like, this is certain cases, of course. People have like, for example, cluster headaches or something like that, or along those lines. People put Botox around their forehead, and it actually stop because it's paralyzing the area. You're gonna actually prevent yourself from having those headaches.
Preventing the pain. Not the
Yeah, pretty much.
Not the headache. The headache
Yeah,
there.
I mean, but in a way, because you're paralyzing the nerves itself, you're not actually feeling the headache itself. At the same time, I believe even in dentistry, there's a way that we kind of refer some patients if they've got, for example, something called bruxism, which is a form of grinding. You know, grinding your teeth at night and everything else. Obviously, the first thing we would do is give them night guards. It's less evasive, you know, no injections or anything. So we just give them guards. If it doesn't really work out, then Botox can be an option. It is an option to prevent them from like subconsciously biting onto your teeth during the night.
Okay. What I was going to ask you, that acid liquid, someone told me it dissipates throughout the body. It goes away, and that's why they have to get it done every couple of weeks.
Correct. Well, I mean, it's 6 months, essentially.
Is
so
it?
every 6 months, 6 months to 9 months, obviously every patient reacts to the body differently. Yeah, so you'd have to kind of keep doing it.
My next question is, I don't know if you know how long it's been around or they've been doing it, because what come to mind is, you know, the women who have the fake breasts.
Yes.
And now they've realised there's issues. So a lot of women having these fake breasts removed.
Yes.
Because of the health.
Yeah.
To me, you didn't have to be Einstein to realise that.
Of course.
How long have they been doing this? And do you reckon there's any like after effects? There's long-term after effects. So I think there must be some long-term after effect that's going to occur.
In terms of Botox and fillers?
Yeah.
I mean, surely, look, if you're practicing it, you know, how do you say it, in a more ethical way, so you're not giving more. For example, let's say a patient wants to have like, I don't know, 4 milliliters of Botox every single time, which is a lot, like a massive amount. If they keep doing that, it can obviously, how do you say, I mean, I'm pretty sure you've seen some clienteles or people that drive in your Uber as well. You know, the more older you get, they might have done it for like 2, 3 years, 4 years, and you know, their face kind of changes in a certain way, because they lose. So if it's for Botox, for example, you lose your tightness in your skin, and because that's what people do. So they get some collagens injected to themselves, they get some Botox injected, and obviously the more you do that, the more, you know, looser your skin gets, and that's how you get old. Of course, you start to get wrinkles, so on and so forth. I think Simon Cowell, recently there was a post about him. He's had so much Botox, like his face looks so disfigured. Literally, like.
Does he look like a boxer or something?
Yeah, it's like someone, like, you know, just gave him a little pinch from the forehead to the nose, like literally just pinched him up from there. And there was even a quote saying that apparently his son's like really scared of him now because of the way he looks.
I think I heard something about that.
Yeah, it was on the newspaper or something. I'm pretty sure I saw on my Snapchat or something like that.
So he's gone down a road of no returns. He's got to keep on doing it.
Well, in
Unless
a way.
he starts exercising. Why doesn't he just exercise?
I mean, there's
Just
so many things you
exercise.
could do.
Yeah,
So many things you could
just
do.
exercise, eat healthy and exercise. Go for long runs.
You know, we live in a time where we just want things to be done, especially in London. Like, we just want things to be done, served to us, and things to be done like straight away. You know, all the things, fast foods. You know, just like our bodies, for example, as well. Like, men are subconscious about their body. If, you know, if they're built, they're not built. You know, they want to have like a much more fit body. They find like routes to get more quicker, built quicker, ripped quicker.
I think a lot of men are just dealing with young guys, I'd say, not even older guys. I think the older guys are a different school.
Of
They
course.
accept themselves or just work
Yeah,
out.
throughout time you start to accept yourself.
The younger guys, well, I'm not sure if it's because I think, well, mind you, we didn't have as much technology in the older guys' days.
Yeah.
But younger guys are happy with the creatine and all those shakes
Yes.
and all those kind of things, and just looking good up top.
Yeah.
They've got weak legs.
Chicken
You can
legs.
tell that they've never really worked out before.
Yeah.
They just look big up top. They couldn't run long. They couldn't fight. And
That's it.
The other things. What's the difference between, you said lip Botox and what's it? You got Botox. What's
Lip
the-
fillers.
So lip fillers that's the acid that goes in your lips, and
Yes.
Botox is for your face.
So Botox is the hyaluronic acid. Lip fillers is actually, it's like as it says in itself, it's a filler. So it kind of fills the area with some kind of a chemical.
Oh.
Obviously, I've studied more dentistry than Botox. I just know the basic foundations of like the things of how the process works. The name, all the details. I mean, there's a lot more things to it.
You're going to open a practice doing this, or start something?
To be honest with you, my aim is to obviously open a dental practice. I work in a practice in Central.
Mm-hmm.
It's a private-based clinic, and they do a lot of like orthodontics and cosmetic kind of procedures.
Mm-hmm.
It's a lot of bonding, veneers, all that kind of stuff. So it kind of gave me a more of a idea of where I want to do or what I want to do, basically.
Mm-hmm.
Especially with the Botox game, I kind of want to mix it around, which is what essentially what most dentists are doing. They're mixing it up. They're saying, look, we've got a beauty and a dental clinic. And that's what they're doing. They're hiring a lot of nurses or just general people that do Botox, hire them out, make some more money.